common low back pain diagnosis is disc degeneration disease. As scary as the name sounds, I wouldn't let it scare you because there's many treatment options that you can pursue to avoid the pain. Now let's dive into it. When we think about low back pain, it's all about alignment and where actually the pressure is taking place. Many times people actually do have the disc degeneration, but they don't have the symptoms. So we have to find the underlying issue or condition that's going on, in your case, that's leading to the pain, which could be generated from quite a few different places. So let's jump into it. We have this model here which shows the pelvis, which you want to look at sometimes as a whole, but also each part's doing something a little bit different. So we look at the pelvis, you got your two SI joints, your sacroiliac joints, and then the spine, the vertebrae that sit on top with the disc in between. So when we look at it, we want to think about what's happening from an alignment standpoint, but also from a compression standpoint, and what's causing your actual pain. So when we think about this, sometimes depending on your hand dominance, it's always going to have a certain pattern that we go through. If you're right-handed, the right side is typically going to be either elevated or rotated, vice versa on the left. So let's just look at it from maybe a right-handed standpoint where you have the opposite rotation. So one side maybe gets offset where it's elevated, and then the left side does a little bit of a counter rotation. This will throw off the alignment of your sacrum and also the pressure points because of how it offsets the alignment of each vertebrae. Now this model is going to be difficult to show you on this video of all the different moving pieces that are happening at once, but yeah, I think you get the big picture here. Each disc is in between. So if you're looking at it from the back side of where it's getting compressed on the disc, it can lower to the point where if you do have the disc degeneration disease, that's a compression site that we do not want to have happening, because then yes, it can be adding to the pain that you're experiencing, and we're wanting to look how to offset it. So when we think about this, we want to look at it from a game of forces, like what's causing the extra pressure to that site. So then we can control the surrounding factors. The vertebrae in general just line up on top of each other. So we want to think about what we can do to set yourself up for success so that each part of the pelvis is in a better position, so it's not keeping you locked down and those pressure points continuing to be pressed on, causing that extra pain that you're experiencing. The discs themselves can also slip forward sometimes, again, depending on which muscle groups are tight or pulling forward. I wouldn't get too caught up in that right now, but just understand the big picture of what's going on with your condition and how to overcome the pain and avoid any kind of symptoms that you're experiencing. So I want to think about whether the alignment of the vertebrae are off, or maybe there's a pressure on the disc. Again, depending on the situation, you may have either a little bit of a rotation, which is causing the pressure in that point of the disc degeneration that's increasing your pain. So we want to offset that pressure point. So that's the treatment method. We want to look at what we can do for the bigger factors around there that have the most force, most pull, that are actually keeping you locked in and keeping you from being able to move, increasing the amount of tension that you're experiencing, whether it's the front side, the side, or even the back of that disc that's causing your pain. Now, when we think about the disc degeneration, it's also about how much fluid is in there. The disc is highly innervated, meaning a lot of nerve endings. That's why it has the pain a lot of times when maybe something gets compressed. But there's also a lot of fluid. So throughout the day, most people, maybe whether they're moving around, sitting, or just doing certain activity due to gravity, have that extra compression from up top that's forcing that fluid out. Thus, there's more pressure at that site. So the tendency is to have increased mobility, improved ability to go around and do stuff without pain in the morning versus toward the evening. Now, it's not always the same case, and that's just where it's trying to narrow down what are all the pain sources that are actually contributing to the condition you have. So if you're one of those with disc degeneration, I wouldn't let it, again, scare you, because the name does sound scary. A lot of people have this. It's wear and tear over a period of time. We all get that with aging. But again, a lot of the times we're just looking at what are the main factors that we can do to go there and control it. So when we look at it from a physical standpoint, physically, from an alignment, what can we do to control the bigger bones that control the smaller bones that are compression on that site? And then what can we do surrounding to maintain where it's at? Now, you may look at some other ancillary services, such as any kind of modalities, heat, cold, electrical stim, other stuff that improve the blood flow, such as hyperbaric chamber to improve speeding of the healing of the processes around there, or even ozone therapy. Another case that you want to think about and even considering, which is a very effective and prosperous method, is stem cell injection. Stem cells are very effective at getting in there, improving the healing rate of the disc, because again, the disc is, even though it's highly innervated, it doesn't have a lot of blood flow supply. There's certain areas of the body that don't have great blood flow supply, so thus they don't get the extra nutrients they need to get to speed up healing the area, and then you continue to experience the same symptoms. So overall, big picture is knowing that there's a lot you can do for it. You can speed up improvements of how you're feeling, how you're performing by just working on alignment, and then you can look at the ancillary service to improve your overall human function and performance.